In Ghana, maternal mortality is still high. So losing one woman is like you have lost the whole nation. So it is not acceptable. My name is Abdullahi Osman. I'm a midwife by profession. I take care of pregnant women and their babies. What attracted me to this profession is, why should a woman lose her life? I found it very difficult to understand.
My name is Professor Victoria Bam. I'm professor in the School of Nursing and Midwifery. Male midwives can play a role in reducing our maternal mortality. In Ghana, largely, the focus of midwifery training has been female-dominated. So the ministry decided to pilot the training of male midwives. We had some males within the nursing program who went on and did midwifery. It would be good to revisit the training of these male midwives.
My name is Ramatu Abdul Hamid Al Hassan. I am a public health researcher with a focus on preventing and also reducing maternal mortality. The story of George, who is a male midwife, asking us to do this study, I think it came from him speaking to Dr. Martina and telling her that although male midwives are few, they are making a difference. And I think that it was his persistence that basically sparked this project.
I'm Dr. Martina Anta-Akra. I am a professor and reproductive epidemiologist. So I was just sitting there minding my business, and I was collaborating with midwife Sally, who is a phenomenal social media advocate for maternal health. And I suddenly got a message from someone by the name of George, who said, "Are you studying male midwives?" And I thought, male midwives?
My name is George Nketia. I'm a male midwife. I was thinking that there is this position against male midwives. I was trying to see if we can get an information that will tell people or that will educate people that male midwives can perform better.
The 3 delays framework is actually a model that's used to explain why women have problems during pregnancy. The first delay is the delay in them getting the knowledge and the education that they need. The second delay is the delay in them getting to where they need to go to get the care. So that's transportation related. And the final delay is the delay in them getting the actual care that they need once they're in the facility. Male midwives in Ghana actually contribute quite a bit to all the 3 delays, but specifically the second and the third. So when you have a male midwife and they're able to transport themselves to the woman, or they're in a rural setting, we actually overcome that transportation barrier because they ride that motorbike and they get to where the woman is. Male midwives also contribute to the third delay because once they get to the woman, they bring that skill set with them. So now we have covered the second and the third, and while they're there, they can educate the woman and the family actually. So now we also have the first delay covered. So they actually really contribute to the first, second, and third delays.
I have opportunity to serve in the urban cities, but I personally choose to come to the remote area. We have to educate people about our culture and traditions. In case of any complication, the man will be able to transport the woman to a nearer facility that can help to save this woman's life.
For women in their young, youthful days, some will just have married or are looking forward to get married or have just started their own families with young children who are in school. So most of the time, people will look at amenities, social amenities, including education, that are in the areas they have been posted in making a decision whether they should go there or not. Because a lot of the time, the ladies would look at and would want to be where their husbands are. And so it affects people accepting to go to remote areas.
So I'm Michelle Levine. I'm a professor in the psychiatry department here at Pitt. Martina first mentioned to me that she was working with male midwives. And why do we need men to do something that specifically happens to female bodies? Martina told me about the importance of involving men, especially in Ghana. And I have become sort of wowed by the possibility it allows.
When I interviewed the male midwives, what I heard was dignity, a passion, and a calling to serve.
I think it would be good for the policymakers to look at it again and bring male midwifery back into our schools.
The male midwifery, they need to bring it back. As I said, the remote area is very difficult to send mothers there to go and conduct deliverance. But if they bring it back, it will go a long way to actually help the nation to prevent maternal death. So bringing the male midwifery back is key and is needed in this modern time midwifery.
I would advocate that if we revisit their training and deployment to areas that they are most needed, it will be good to put a system in place that continues to monitor and assess their contribution to healthcare.